Hello and welcome to Podiatry Practice Mastery. My name is Don Pelto and I have Per. He's also known as the Price Whisperer with me. Welcome, Per.
Hey, Don. It's a pleasure to be on the show, and I'm looking forward to our conversation.
Thank you. Thank you. Well, we're going to talk a little bit. A lot of us as doctors or physicians or surgeons, we hate talking about the P word. We hate talking about price. If you ask me, Per, I give everything away for free in my office and I don't ask. If you ask my staff, they're the ones that talk about price for me. So can you talk about some of these elephants in the room with doctors and pricing? Now we're talking United States, because I know you're from Scandinavia where everything is free, right? We wouldn't even advertise. I was recently in Portugal and I didn't see any doctor ads because it's all public health. But in the United States, I think was it California you're in?
Yeah, I'm in Los Angeles. Yeah,
Los Angeles.
I've been here since 1994, so I'm getting used to the system here.
Yeah. So what is your impression with doctors and our hard time talking about price and getting what we're worth?
Well, a lot of service providers that has a service that they provide to their clients. They have a certain expertise, and that's their expertise, you know. And price is then something that is very uncomfortable for a lot of people. And price is uncomfortable because if it's not presented in the right way, it can generate friction, right? And because of that, I'm sure that also the the circumstance for a price discussion is probably going to be very, very different if a patient comes in and let's say have a broken thumb, right? Versus the price discussion for somebody who's going in and going to do breast augmentation, right? Whether in the latter, the discussion about price is central, right? And it's not going to, and the buyer is going to, at least to some extent, make the decision for which doctor to use based on price. Whereas in the broken thumb, it's okay, just fix it, you know. And going to that second example, the breast augmentation, price is interesting in that it's the most powerful message that we have when we sell something. The most powerful message of benefit and quality. There's something called expectation bias. And we expect a certain outcome when we pay for something, and if we pay something that we believe is a very low price, we expect a not very good outcome, even to the point that we decide this whatever I'm going to buy is so cheap that I don't think that it's going to work, you know.
I like that. In terms of for talking about price, there's a challenge these days because there are certain things that are covered by insurance and there are other things that aren't covered by insurance. I'll talk a little bit within our profession. Maybe, you know, x-rays are covered, office visits are covered, but other things like inserts that go in your shoes, like orthotics or some treatments called shockwave treatment, and these other things aren't covered. And what I sometimes find the challenge that doctors have is, how do you introduce them? These, you know, and then how do you say, well, I'd like to do these other things that cost more, but it's because it'll get you better faster.
Yeah.
And there's a certain benefit to that.
Yeah.
Any tips for talking or having those conversations?
Well, first of all, you always want to give the patient in those particular cases. You first need to, well, first of all, you should give the patient a choice, right? And again, let me give you an example. You know, my wife broke a toe broke a bone in her foot, you
Uh-huh.
know, and the doctor said, you know, yes, you can have this shoe that the insurance pay for whatever 3 months or 6 months, what it would take for it to heal, or you can have this other shoe, which is different, that the insurance do not pay for, and it's going to be $150, and it's likely that you're going to be cured much quicker, right? So she had a choice, right? And of course, you want it to be cured quicker. So when you present prices, instead of saying, you know, this is again, this is the best shoe, is gonna cure you in 3 months, and the price is 150, right? So instead saying that you have choices here, one has higher benefits, but it's also not for free, and so she could make that purchase decision.
I think also when you're talking, I know I was talking to someone else recently, they said you have to have the patient almost understand, what do they call it, the pain of it, of what they're feeling in terms of expressing, what do they call it, you cut it, then you put the salt in it, and then you solve it. I think that's what they call it. But I find, as physicians, many times we just assume that we know their pain, and we don't actually have them talk about their pain. And this is something I'm working on learning to do, because the more they talk about their pain, how it affects them, the more motivated they are to get treatment. It's almost like applied psychology. It seems complex and it seems unnecessary, but it's one of those things that is necessary for physicians.
Yeah, absolutely. And it's also there's a lot of how should I say, there's a lot of things that people think they have the right answer to, you know, and like there is a guy that's written a very interesting book called predictive irresponsibility or something like that. I can send you the information after this, and you can put it in the
Show notes.
Predictably irrational. That's what it's called. And one of the things he came up with, the idea of the book, is he got burnt, seriously burned, and so he was spending 3 years or something like that in a hospital bed with all, you know, dressed up with whatever they dressed up burn victims with, and one of the things that he said was that it hurts when they were changing the bandages, right? And all the nurses came in and always said, you know, we're going to rip these bandages off really quickly because it's going to hurt less, right? That was something that everybody knew, right? But in fact, there's never been any research on it. It's just that common knowledge that may or may not be true. And so he forced these nurses to sometimes rip them off very quickly, sometimes take it very, very, very cautiously, you know. And I can't remember what the outcome is. I think he ended up saying that if you take them off very cautiously, it doesn't hurt nearly as much, right? You have a little bit of pain for a longer period of time, as opposed to a very sharp pain for a very short period of time. And in his his name is Dan Ariely. And it's from that perspective of what you're trying to say, it's a fascinating book, actually, of really because what he's trying to do is really understanding how the you know, how we work as humans when it comes to decision making and so forth, and purchase decision making.
Yeah, Pro, I don't know if you could talk a little bit to like the challenge of having too many options. One thing I learned early on in practice, let's say I'm talking about a $2 pad, you know, it takes me the same amount of time to talk about a $2 pad that they're going to put on their foot or a $550 orthotic that they're going to get. And I use just as much energy, just as much enthusiasm. And many times I found that later on in life, I just give away the $2 pad and I spend double the time talking about the more expensive type of treatment because all time isn't created equal, especially when you have 10 or 15 minutes with your patients. We're very limited in terms of our time. We don't have the luxury of it being a half hour or 45 minutes with a patient. How do you reduce the amount of confusion? Some people have talked about putting things in packages. Some people
you can do bundles.
Presenting things for patients.
But in your case here, are those two, would they have equal outcome?
And let's say we're talking about it. Let's say you have a painful area on the metatarsal on the bottom of the front of the foot. You can get a pad that you put on there that cushions it temporarily, but that pad's going to wear out. It's going to be $10 or $15. Or you can make something that'll offload it permanently, which is the insert that goes in your shoe. They're totally different. The orthotic is much better long term, but it's much more expensive to do. But I find in the beginning, I used to say, well, you could try a pad, you could try an orthotic, you could trim off the callus, you could do this. And I confused the patients because I threw too many. I felt like I had to educate them about all the options. And
no, you should. I mean, yes, it is actually good to have the patient choose, right? The maximum number of options you should give them is 3.
Okay.
Okay. And in fact, there's been research in this on very different subject, but university research, they put up a little store, so to speak, in a university, and they presented folks with 6 different types of strawberry jam, right? And about 30% of those who went into that store bought strawberry jam, right? Then they extended the experiment, and they had something like 50 different types of strawberry jam, right? And the result was that 3% of potential buyers bought, right? Because of that confusion. As when we make decisions, the maximum number of alternatives we can hold in our brain is 5, right? So fewer is better. That's why I'm saying you want to have, if you give your patient 3 options, it's going to be easy for them to make a decision, but it's also going to leave them with the sense that I was in control, right?
That's nice.
And I was not told what to do, and things like that, you know. And that then generates customer satisfaction. They will come back. They will write a nice review. They will recommend you to their friends and family and stuff like that, you know.
Now, talk a little bit about. We talked a little bit about packaging treatments or packaging. Would it be like 3 different packages? Because a lot of times I have patients, they come in. You got the package that the insurance covers. You know, you can try to do it on your own online. Or you can do kind of what's best to get you better quickest. Is that kind of what you mean? Or talk a little bit about packaging?
That could be it, or it could be it could be it could be different packages of I don't know, different, like you said, different treatment options or different physical devices that will help them in one way.
You can do a custom orthotic, you can do an over-the-counter orthotic, or just a new shoe or something.
Yeah, something like that. And the other thing that you may think about, and this goes particularly to pricing and customer satisfaction, is that if you have if you have a patient coming in and you know that the insurance is not going to cover everything, right? So there's going to be some kind of cash transaction happening, right? You want to have that cash transaction when they check in, okay? And that's because a cash transaction is something that is slightly negative, right? Okay. And it's much better for a patient to leave being happy with whatever treatment they got, right? Or with whatever product they got with them or whatever. So the patient leaves with the memory of the good memory of the treatment, not with a less good memory of they took my money.
Mm.
You see how that works?
I like that. So that's why we pay the copay before you go see the doctor many times.
That's right. Yeah. Not before.
Yeah. Why? I'm just throwing, I think I know the answer, but I want to ask you, why shouldn't we just give stuff for free to the patients? Like, is there a reason to have people financially invested? Let's say insurance doesn't cover it, and we could just be nice and do everything for free. Is there a reason why we maybe wouldn't want to do that for patients?
Yeah, because it's if you get something for free, you go home and toss it out, or you put it on the shelf, and you're not vested in. You have no reason for being for using it. You know, as I mean, I don't know. I'm probably very typical, and I had one doctor that I'm not longer with. And every time I was there, you know, I got oodles of free samples of different medicines that he thought would help something, you know. Never used any of them, you know. I mean, why should I? I mean, it was just free. It was free giveaway. Maybe and there is in the pricing world, if you like, there's something called expectation bias. And expectation bias works in two ways. First, and I mentioned one way is that price sets an expectation of the benefits and quality of what you're about to buy. And if you wait too cheap, people won't buy it because it's too cheap, you know. But it also affects our satisfaction. So multiple studies have been made to prove that a 5-cent aspirin is not very effective curing your headache, whereas the 50-cent aspirin is. You know, so it's the placebo effect. You know, we only because, or it's related to the placebo effect, only because we've spent a lot of money on this one aspirin. We know that it's going to be much better than the cheap aspirin, and because of that, it's going to work better.
Or we're more motivated to do what the person told you.
Yes.
You know, if you buy it, you're more motivated to do what it takes. Yeah,
that's right.
Talk a little bit to me about positioning and influence in terms of, let's say one doctor takes 3 months to see because they're in such demand, and the other one, you can do the heart surgery tomorrow. You know,
yeah.
How does positioning, you know, affect people's willingness to pay price? Well,
in a way, it's also very similar. You know, that doctor that is thought after, whether he is or not, but I mean, salespeople, right? Salespeople, they fill up their calendar for the next 2 weeks where they have nothing to do, you know, just to make sure that if somebody's trying to get hold of them, it's hard to get hold of them.
Really?
You know? Yeah, absolutely. and or other service providers. If and now of course we have so many shared calendars and stuff like that. And if I go to somebody that I want to meet for whatever reason, and I don't care what, who that person may be or for what reason, but if I'm supposed to find somebody and I see their calendar and I see, all right, they have sort of one meeting tomorrow and then it's wide open for the next 3 weeks. That is not somebody that is in particularly high demand, So, so what folks do is that they all set up fake meetings, Well, you set up meetings so there's empty space here and there, so you can find the time. But I mean, that you become much more desirable by that.
Yeah, I've played around with this idea for I've put together almost like I call it a heel pain 14-day heel pain course.
Mm-hmm.
When patients come in or before they come in, I find the ones that do the course before they come and see me, they're much more motivated and they do pretty much everything that I say. Those that have downloaded my books, for example, those that have done some work prior to seeing me, they're much more motivated because I just do the same spiel I always do, but they've already been exposed to it.
Yeah.
And what I'm doing now is I actually started to charge for that 14-day course if you're not a patient. So $29 for the course. But if you're a patient of mine, I give you a special code that you can look at that 14-day course. And I'm always testing what's going to be the next way of doing it. That's what I'm doing now, is trying to have people, if they want information, they get a little free book and then it offers them the course. And I don't know, I'm going to see how it works. I don't know if you have any tips on, I guess that's called marketing or drip marketing or things like that.
Yeah, it's I mean, the reason it works better when people buy the book, they read the book, and then they come to you, they are already sold, right? And I don't think it's a good idea to give them a free book because it's just going to end up on the shelf somewhere,
Even if it's PDF, even charge for the PDF, you think, if it's like a PDF book?
Of course.
Thank you. I never thought. So let's talk about the biggest errors people make in terms of not charging for stuff, right?
Yeah, I mean, again, if you don't charge for it, there's no value.
They're not going to read it.
Yeah, they're not going to read it. So, I mean, if you have these PDFs that you send to patients, put it up, self-publish them on Amazon and charge them whatever, $3.99 or something. And even though you call it maybe a guide or whatever it is, it's something that and obviously you direct them to Amazon, but suddenly it's something it's tangible, or they can download it as a PDF, or they can download it to their Kindle. If they don't have a Kindle, they can, they can download the Kindle app on any platform, but they then actually buy something, they go to a place where you buy stuff and they buy something, and for that reason they are vested into the process.
That's great. I think the conversation in my head, Per, is that everyone, from what I read, the marketing people, they always say you want to try the free economy and pushing things out for free, but maybe a lesser thing, maybe a little checklist, or because is there still room for having these little checklists or these little, what do they call them, lead magnet type of things? Yeah,
you can have little checklists or little one or two pages of sort of brochure like material. But if it's something a little bit more substantial, it really should be it should be, you should charge for it, and and it also it sort of works the whole way, because when you have somebody who's actually paid for some of that material and they come to you, they already drank the Kool-Aid. So they're very positive to whatever procedure they're going to have.
Mhm.
And because they're positive to the procedure, the outcome of the procedure is going to be better. And they're going to be happier customers, and they're going to write happier reviews. They are going to be more likely to recommend you to friends and family and so forth. Yeah.
So we're actually doing a disservice by giving away too much for free.
Oh, I think so. Yeah.
That's, the doctor mentality is, if I have a willing person that's willing to do stuff, but I don't know if they're willing to do it. I don't even know if they're reading the books or just, downloading them and, oh, that's that. So thank you.
Yeah. If lead magnet is something, a lead magnet is you give something for free in return for folks giving up their
Email or something.
email and phones. And then there need to be somebody that follows up.
Yeah. Well, that's good. I think we've covered a lot of good information here. If people want to learn more about kind of pricing strategies, and I'm going to put this link goforward.com. I'll put that underneath someone that you've worked with. But if you want to learn more about you, would your book be beneficial?
Yeah,
and other things?
absolutely. The best way of finding me and finding the book is just do a Google search on The Price Whisper. You'll find oodles of hits, and you find me and you find the book, and I have a YouTube channel, and I do a lot of blog posts and so forth. So
great.
Yeah.
Thank you, appreciate your time. This was very, very insightful.
All right. Thank you. I'm happy to be of help.
Well, thank you for watching this interview with Per. That was a great interview about pricing. There's a couple of good books, one by Robert Cialdini called Influence, which is a good one. Also, The Price Whisperer, his book. And I do have information within the Practice Mastery Academy. I'm going to put some information underneath about that if you want to learn more. It's including that 30-day practice blueprint. If you're familiar with the 30-day blueprint, I used to give out for free. The reason I don't give it out for free is everything we talked about now. People that actually buy it, they actually get much more out of it. Once again, hope you enjoyed this. I'm going to put some other links either by the side of this video or underneath if you're listening to it. Okay, thanks.